A couple of provisions in 2012 that I think are worth noting. The summary of benefits and coverages. Now this is an area where, as employers, you're providing some form of brief summary to your employees with an overview of their coverage. Oftentimes you'll use this document as you interview potential candidates for open positions, so new applicants, communication with this document as you approach open enrollment. But now the legislation is going to define the content of the document, and actually the font size, the layout of the document is going to be defined within the legislation. So a little bit different view on those summaries and how that's going to work. The other part that's a little troublesome to me from a logistical standpoint is there's a 60-day advance notice of material changes to the plan requirement. Now currently that notification is a back-end requirement. Now it's going to move to a front-end requirement, and it applies to new applicants as well as re-enrollments. In other words, open enrollment. So by show of hands, as employers, how many of you in the room have your renewal completely done, decisions made, paperwork signed, ready to communicate with your employees 60 days minimum before the effective date? One. And I think he was kidding.
He brought it down real quick there.
So this really will shift the mindset. And unless there's some clarification that gives some leniency to this, to me, in the first 4 years of legislation, this is a biggie. Everyone will have to adjust. Your health plans will have to adjust significantly if you're fully insured. Most don't even prepare the renewal until close to that time frame. So,
and this is the kind of thing that if you don't get it out on time, you can be subject to those ERISA $100 per day per violation penalties.
Per employee?
Yeah, per employee.
yeah, so a little frightening on that particular one. There's also what's called a comparative effectiveness fee, where there'll be some agencies created within the federal government, maybe companion at state level, that will do research and give employers access to effectiveness of medical procedures. And we will get to fund that. So as employers, there'll be, in year one, there is a $1 per covered beneficiary fee that's required. In years 2 and thereafter, that goes up to $2. So there'll be some additional revenue generating provisions that employers will contribute to fund some of the provisions and tools that you'll have access to under the legislation.